Dear students, we are now in the seventh part of sensory integration therapy. So, tactile defensiveness is when sensitive to light touch. The child is sensitive or high, what we call as more sensitive to the light touch. Touch causes difficulty for these childrens, leading into difficulty in organized behavior and concentration, or what we call as attention, which is required for learning. That's why if concentration and attention is not there, the child cannot learn anything. The child, because attention requires, because learning the process, in the process of learning, attention is a first step, so that whatever new concept or new idea the child has to learn, he should will single-handedly transmitted to the area of the brain, so that it can be memorized. While there is no attention, memory cannot be there. That means the child cannot memorize, the learning has not happened. Simply teaching and teaching and trying to read and read without attention, nobody can memorize anything. Without memorizing, learning does not happen. Touch causes negative emotional responses. In these children's the touch can lead to negative emotion, even because a small touch or what you call as a simple touch may create negative discomfort, and a child may start to cry. Can become aggressive if the feeling threatened or stressed. If again the small touch negative emotion response comes, and further on, if you try to hold the child or try to give deep pressure, the child may threatened and stressed, and sometimes may the children may act in different way. The response either may be crying loudly, or sometimes beating, or sometimes pushing the other person. Intervention for tactile defensiveness. Brushing protocols. So tactile intervention treatment is brushing protocol. Wilbarger protocol, that is brushing over arms, legs, back with a soft brush followed by joint compression. So in this protocol, the Wilbarger protocol, what we will give is, we will give a slight soft, using soft brush. We'll give start very graded, simple sensation of touch, light touch, and then you will add it with joint compression, that is proprioceptive sensation. And then here, we will try to move from soft to a bit more less softer brush to a harder brush. So this is a gradual way of giving sense stimuli, that is tactile stimuli, and so that the child gets adapted to even the hard brushes also. But we are not saying that the child should not feel hard brush. The only idea is the child should be able to tolerate it rather than cry or to the avoidance. So the idea is the child should feel that the hard brush is hard brush and a soft brush is soft brush. Here the only thing is the child should be able to tolerate, like how a normal person can tolerate it. So basically, whenever we give these kind of approaches, first apply to our body wherever we are applying. Because we are applying the brush on the child's lower foot or knee area, try to apply that into our body and see what we feel. Whether if it's tolerable for us, then you can go for that kind of therapy. Caution: a brushing protocol should only be implemented after an assessment and training by a qualified professional. See, this 1 hour or 2 hours of training in the sensory integration therapy is not enough to treat a child, go and treat a child, because you need to work under a qualified professional and to observe as a junior therapist. If you're not aware of what to do, you should have ample quality observation hours with a very qualified professional. Then only you can start treating. Otherwise you will be actually not giving the real sensory integration therapy. You will be feeling that you are giving sensory integration therapy, but the child will not be benefited. So we can say that the basic idea of what we call this is a what we call as a sensory bucket. So the whole blue color you can see is a sensory bucket. So in this sensory bucket, the child is able to have all this. The area of the acceptance of this may be initially smaller, so we will increase the size of the sensory bucket. So important things are the three power senses. Vestibular input, which is a major one, the major power sense here. Vestibular input, proprioceptive input second, then the tactile input. These are the three major power senses with which we have to try. We have to, whenever we think there are, all this taste, smell, auditory, we leave the smell and we taste, because we don't use only that comes into play in oromotor feeding problem, oromotor problem. So mostly the other two senses we commonly use for movement. Normally, upper limb and lower limb and movements, we try to use vision on in auditory. But vision and auditory mostly is used as a supplementary or kind of additional to the three power senses, which is very essential. So to fill the sensory bucket, quickly use the power senses. The three power senses will provide more input more quickly to make changes that are more rapid. The environmental support for power sense, access to an escape to bar private area. So you can give an escape area, private area, but that also should be, child may feel that he or she has escaped to a private area, but it also should be a controlled environment. Caution with placement. Student may want to sit where no one is behind him or her. Some feel secure with boundaries that keep others at a distance. Others need space in order to make a quick escape. So these are the areas, quick escape area. So the child may come out and then go and sit here in a corner, on this, what do you call this, the different types of texture. Maybe this kind of texture, like a ball, can be used, or kind of a like a soft, shape changeable, materials can also the given. And sometimes you can give an outdoor view. The child may, some children may require this. Some children, if may they are getting distracted, this is not going to help you. And this cushion and this area, the child may feel very safe, because this maybe the child is familiar with this, all the stimuli which is coming from this area. Maybe the lighting is comparatively lesser, the bright light may be the child may feel abnormal response, hypersensitive to bright light. So these kind of curtains may be used. All those can be controlled. You have to check everything, all these sensory stimuli, how it is coming over regarding the auditory. So from there, even inside the clinic itself, the child after session may go for, find his or her own area where in the corner go and just relax. And this is a kind of sometimes it can be an escape or avoidance. So sometimes it's necessary to give a break time. That's what we mentioned here. Quite sensory area. The child may have a quite sensory area of. See here, even though it's a closed board, we are separated the clinic with a board, but we are using different types of colors. Whatever we are using, it can be used also for teaching something. We can ask the color of this. When you're simply sitting here also, we can do some activities with child. What is this color? What is the shape? You can give this as a square. Then here this one can be triangle, circular. So learning process, even though the child will not feel that, because this child will feel that this is normal, wall. But everything can be used for learning, and also for gradually accepting the different type of different quality strength of the stimuli can be introduced, and can be the child will try to adapt. So this the sensory integration therapy is a holistic approach. In tactile supports, you see heavy blankets, pillow. So because you want to teach the child with tactile sensation, best thing to use is a heavy towels and heavy blankets, pillows. The sometimes using here also you're using lap pads here, where you're placing your elbow. Sometimes that may be disliked by the child, so you can give a towel. So what you're trying to overcome the sensory problem, and make the child do the specific activity, so that the behavior of the child becomes normal. So lap pads can be, because when you're sitting, they feel like something is, that gives a psychological support. Some a bit, not a very heavy lap pad, but something like similar to a blanket. And for example, for tactile problems like gripping a pencil, there's a difficulty, so you can give a larger area, so like pencil grips, pen grips with a larger area to hold on to. So this will also improve the activity like writing skills and drawing skills, all those skills, fine motor skills, whatever you want, manipulative skills also, sometimes opening the keys, even it can be applicable for a key to open the lock. Those kind of activities, try to improvise and try to give, if a particular texture is not acceptable, but gradually change that, gradually, slowly change that behavior, and try to, first we will try to change the behavior, then try to normalize, bring the child's ability to that of the same to the normal child's ability. So all these kind of will be fidgety items. Initially the child will only feel attentive with this, what he or she likes. So go with that, and later on slowly change. Okay. So avoider or overwhelmed person will like these kind of big balls and to touch it and sit on that. Avoider will go and slowly touch and see. The under response, though the child who is showing no response, will require a heavy sensory. Even by looking at this, even when I show you this figure, you will feel a lot of psychological. You feel like this is looking like an octopus. So you get a visual sensation, the color of this, the shape of is with a lot of tentacles, so you can relate. So as person who is has less response, if you give a ball, but if you give this one, it is similar to a ball, and they can use it to crush it and to feel it in their hand, but this will give more sensation. So the seeker who want more and more sensation, they will love this. So avoid. So try to change this person to gradually to this area, and from this person to avoid. The avoider person will not go to. They will feel dangerous for them this too. So slowly, gradually take them to this area. So that is our idea. So other tactile supports, consider the type of clothing and the way it fits. Tight, loose, fabric, type of fabric, swimming in water play, body soap, all this. Try to understand the which is the cloth that what type they like, what whether they like tight clothes, loose clothes. Try to understand everything, and try, if it is highly tactile sensitive, try to check why they are not wearing a particular dress. Look for any tags inside, any rough edges, any embroidery which is pricking their skin, those kind of things, and try to solve the problems. Sometimes in a body sock, this is actually, normally we use a big towel to totally close a child when during learning process. So body sock is also useful, because the whole sensation felt by the child will only be the sock, wherever, but outside you may give whatever sensation. The child first sensation would be the sensation felt by the body sock. So that is a good way to provide attention for the child to improve learning skills and those kind of activity skills. Whatever you want to complete the task, the orientation and the attention will be there. People support what others can do. So avoid unnecessary touch and ask permission. So try to avoid unnecessary touch. Don't feel that because the child has a problem with hypersensitive, go keep on touching and you will solve the problem. It's not like that. Then the child will start hating you. Try to understand the child's problem and try to behave like that. The child will feel very safe and secure with the therapist. The child will understand that this person knows my problem, so he or she knows how to treat me, how to, so they will have a good friendship also with the, having a good rapport with your, that's a, for a child it is a play. The child will feel that I'm coming to the lab to play. So that kind of feeling should come with you as a good therapist. Otherwise, if you don't enjoy the session, the child will not enjoy the session. So try to make it more interesting. The child should always feel that the child is coming to you, to your lab or to your physiotherapy center for playing rather than for very boring sessions. Avoid touching face to gain. Don't touch the child. Suddenly the attention is not the child is looking there. Usually what the other normal people would do, grab their hair, touch their slightly slap their faces. Don't do these kind of activities. Those are not correct method. Move slowly and provide waiting time up to 10 seconds. Give ample time, give ample space initially. Try to gain the confidence of the child first. Without gaining confidence, don't try any big techniques and all. Try to be patient, give some enough time. When touch is necessary, use deep pressure. But whenever touch is necessary, when you're holding, give deep pressure touch and give maintain the touch. Don't give fidgety touch and just like grabbing like just simply using your tip of the finger and stroke it. Don't do stroke it. Give deep pressure and maintain the deep pressure. That is very therapeutic.